Well, Dr. Rosemary in the afternoon or maybe in the morning or all the time. We don't even know anymore because Dr. Rosemary is everywhere and she does such a good job. And the only thing is when you come up to her and you smile, she can tell you right away what you need. So good. So hello, Dr. Rosemary. Thanks for being with us.
Hello, Anita. How are you?
I'm great. And you are really, you're such a powerful voice. And you're a powerful woman, as a matter of fact. I love having you as a dentist. I mean, You are not what people think of as dentists. You know, you are this beautiful woman who you would think, well, she'd be playing, bridge or going on cruises. But you're a hard-working woman, and you love what you do, don't you?
I do love what I do. I do it with a passion.
I know it. I know you do. And your family and you all have beautiful teeth, so you must have really have taken care of them as well as so many of your staff. Let's talk a little bit about teeth. We don't really, that's not a conversation that we have over dinner or with friends. It's kind of like, okay, they're in my mouth, and if they're not good, then I'll keep my hand over my mouth. What is it that we need to do to make our teeth beautiful, and if we don't have any teeth, the right amount of teeth?
Okay. Well, we can talk about what do we do when we're missing teeth, because as you know, so many people are missing teeth, sometimes in the front, sometimes in the back, and when they smile and you can see that they're missing teeth, what they do sometimes is they don't smile as much. I have a lot of patients who come to me, and when they come to me and I look at their teeth and I say, let me smile so I can see what you look like. That's one of the first questions I ask them. And they say, oh, I don't smile. And I think to myself, what a sad thing for somebody to say, I don't smile. So, people not only put their hands on their mouth, but they really don't smile. When we see people who don't smile and they look serious, what do you think? You think maybe they're depressed, maybe something is wrong, maybe they're mad. That's what would be the first instinct of somebody to think if somebody's not smiling or they don't look happy. But it's not necessarily that. Sometimes it's just that they don't have nice teeth or they're missing teeth. So there are several options if you're missing teeth. And the options would really depend on where the tooth is that you're missing and how many you're missing. To start with the most basic, if you have waited so long to go to the dentist and it's so far gone that you no longer can save your teeth, at this point, the option for you is really to make a complete denture.
Well, let me just hook on to something you said. How do you know it's too long? What would happen that you can't save your teeth?
Well, your teeth would start getting loose. They might be extensively decayed. How do you know your teeth are extensively decayed? Because you have holes in them at this point. They might start hurting. Your teeth will start to be loose. How many people know that their teeth are loose? They have shaking teeth, but they don't want to go to the dentist. Why don't they want to go to the dentist? Because they don't want to lose that tooth. It's like holding on to dear life. They want to hold on to that tooth as long as possible. But there's gum disease, and there's infection around that tooth, and by holding on to that tooth, that disease is now spreading to other teeth. So you want to get that treated. So you want to really not wait till it gets to that point, because always my motto is if you can keep any teeth at all, it's better than keeping nothing.
That's my motto, too. Thank you. That's good.
Absolutely, because a denture, whether it be a partial denture, which I'll explain what that is easier to hook onto remaining teeth than losing all your teeth. And you know what God gave us as our own teeth is better than any dentist out there can give you. There's nothing out there that man has created. Even the best implant system in the world cannot replace your own teeth. This is what I teach my kids from now. That's why I tell them about brushing, and I, got my kids the sonic hair. And I'm very diligent with them about brushing because nobody can replace what you were born with. So it's really important that we understand the importance of our teeth. I see patients sometimes in their mid-80s that, Anita, have all of their own teeth. And, and the reason is because they took great care of them from a young age. When they had a cavity, they filled it. When they needed a crown, they got the crown. They did everything they had to do. And then on the other end of the spectrum, You have people that never took care of their teeth, and in their 30s or 40s, they have gum disease, and all their teeth have to be extracted, and they have to go for complete dentures.
Well, I think it's a good time for me to ask you a question. By the way, this is Dr. Rosemary in the afternoon, and we are, if you would want to speak with her, and we're going to offer something very exciting, so don't leave this station. We're going to tell you in just a few minutes something that is so big for our listeners. But if you want to call and you really do want to make an appointment, you say, oh, yeah, I can't do this anymore. I've got to go see someone like Dr. Rosemary. The number is 954-489-1345. Dr. Rosemary, though, there are, as you were saying, that person who's 80 and doing very well, and maybe they have taken good care of their teeth. They've seen a dentist regularly. They've eaten properly. But there are people that I know that my teeth weren't as good as somebody else's teeth, and I guess genetics have a lot to do with it too, doesn't it?
Absolutely. Absolutely. Genetics has a lot to do with it, because some people, their parents had bad teeth, and you know what? They don't have good teeth. So a degree is inherited. But there's a lot we can do to change that. It's not like what's etched in stone, because they say even to people, you hear this, well, my mom had diabetes, my dad had diabetes, so it's only a matter of time till I get diabetes. That's not true. If you can go and you can change what you eat, you change your lifestyle, you may not develop that. Same thing with your health and your teeth. If you go and, okay, my mother had bad teeth, my dad had bad teeth, but if I take care of my teeth, I go and I floss and I brush and I'm doing all the right things, I'm going to the dentist regularly, and when I have a small cavity, I take care of it right away and I don't let it progress and get worse, then guess what? I may not be in the same boat as my parents.
That's good advice. That's excellent advice. All right.
So you can't just accept your destiny in everything. We do have the power to change our destiny, but with our teeth, we also definitely have the power. We can't just take it and say, well, my parents, my brother, my sister, they all had it, so I'm going to have rotten teeth. We can do our part.
Good. I like that. So you are saying that if someone has a loose tooth, they have some bad teeth, they can come in, and why don't we start with that and then tell us what you would prescribe, and then maybe for the person that has just a lot of bad teeth, why don't you just go through everything as though I've just walked in to your dental office and you are giving me a consultation.
Okay. So as I said, if you're missing all of your teeth, we have, the main option is going to be you're going to have a complete denture, because you don't really have many other options. The other options is, which I'm going to talk about, is implants and some bridges on top. That we're going to get to. But right now, let's talk about you're missing all of your teeth. So that is where we do not want to get to. If you're missing one tooth or you're missing two teeth, there's something you can do which is called a fixed bridge. What a fixed bridge is it's two crowns, 2 or 3 crowns placed together. Basically, it's a crown which is put to the right and the left, or the front and the back of where that missing space is. Then all of these crowns are joined together in the laboratory. So it becomes one piece. It's all soldered together. So it's kind of like jewelry, handcrafting jewelry. It all becomes soldered together, and then it gets cemented into place by the dentist. So you come back in. The first appointment is we prepare the teeth next to that empty space. So those teeth are going to, I don't like to use the word shave down, but they're going to get reshaped. Then we're going to take an impression. You're going to leave with a temporary bridge. You're going to come back 2 weeks later, and you're going to have a permanent bridge put in. So a bridge is 2 or more crowns joined together. We can make a bridge of 3 teeth. We can make a bridge of 16 teeth. So it depends what you're missing and what your needs are, what your financial needs are. There's a lot of things we take into consideration. To also have a fixed bridge, the teeth that are remaining have to have some degree of bone. They cannot be loose. They can't have periodontal disease, because that would be anchoring or building on a house with a poor foundation. You always want to have your foundation strong. So really a bridge is for somebody who is missing just a few teeth, For whatever reason, they lost them. The teeth next to it are strong enough, and we put a fixed bridge in.
Dr. Rosemary, can you actually add bone? Isn't there something like that?
You can, yes. A periodontist can add bone. That would be a periodontal procedure, and that's not all over. So that's why you don't want to get to the point where you're missing bone all over. To add bone is usually when your bone loss is localized in a few areas. If you're at the point where you have moderate to advanced periodontal disease, where you have lost so much bone that your teeth are loose, that's not where they do bone grafting. Bone grafting is usually in an area where you have a defect in the bone or something like that, or you're going to receive an implant and you need some additional bone for support. That's where they'll put a bone graft. But they do not graft your entire mouth because you've lost bone from periodontal disease, because the disease is there.
Okay, so when I would come in there, then you would have an examination of my mouth, and you would be able to tell a lot of the things you've just been speaking about, wouldn't you?
Absolutely. Now, if you're missing more than 2 teeth or 3 teeth, if you're missing, let's say, 8 teeth on the top, then I would present you with the option of a partial denture. What a partial denture is, it's a plate with the false teeth on it, depending how many you're missing. Now, they have clips. They have these little retaining metal clips to help keep the denture in place. Now, those clips, what they do is they attach onto your existing teeth. So usually when I see a patient who is missing some teeth, let's say 7 teeth, 8 teeth, 6 teeth, whatnot, I will give them both options of a fixed bridge and a partial denture. Why, Anita, do I give them both options? Because there's a significant difference in cost of these 2 options. So I have to let them know that, this is what a partial denture costs. These are the pros and cons. This is what a fixed bridge costs. These are the pros and cons. I like my patients to be empowered, educated, and that way they can make a smart decision. I don't make any decisions for any of my patients.
You just give them the facts, and then
I give them the facts. They can ask me. Now, if it's clear-cut and they really do not know, but I have to give them all the facts, and they have to make the decision because I don't live with them. Partial dentures, you take in, you take out. For some people, they absolutely do not want anything to take out at night. They want everything to be fixed and cemented in their mouth. So that has to be taken into consideration. Some patients, their oral hygiene is not good, and they just don't have the manual dexterity for whatever reason, or they don't floss or whatnot. For that kind of a patient, a fixed bridge would not be good, because a fixed bridge, you have to have good oral hygiene, because you have to clean under the bridge. Otherwise, you will decay the remaining teeth, because it's still attached to your existing teeth.
As compared to the dentures.
Partial, right, compared to the partial that the patient is taking in and out, and they're cleaning it, they're not sleeping with it, they're brushing their teeth. So it's different. The partial you can add teeth onto. So if the remaining teeth are a little bit questionable, then you would go with the partial denture, because those teeth can at some point in the future be added to the partial, to the denture. If you do a fixed bridge, and those teeth go in the future, they cannot be added to a fixed bridge. Once that bridge is cemented in permanently, it doesn't go anyplace. It's in there for life. So these are all important things to consider. So sometimes patients call and they want a consultation on a phone. I can't give a consultation on the phone because until I meet the patient, I see the patient's mouth, I see the existing, not only the condition that is of concern, but the remaining tooth structure and everything around it. I cannot give an educated answer. I have to take everything into consideration before we can say what to do.
Well, maybe this is a good time for me to give our wonderful listeners a very special treat, because you may be sitting at home saying, oh, I really wish I could go do that, but I don't even know if what it is. And so I'm going to give you a little push. Dr. Rosemary, before the show, said, look, I know you have wonderful listeners, and I would like to offer them something very special. It's just to your listeners, the first 20 callers to their office, and I'll give you that number after, but the first 20 callers, it's a lot of callers. I'm really surprised that Dr. Rosemary is doing this, but she has a very big heart, and she really cares. The first 20 callers will get a free consultation. That means just what we're doing, we're talking, and she's not limiting it to 5 minutes. She loves to talk, and she loves to help her patients, so it's a free consultation. Then, after you talk, you have to make an examination, and she will give you a free examination, and that's not something you can go to a dentist and get. Free examination. And you ready for this? Because you know every time a dentist wants to do x-rays, oh, there's more money. She said for these people, the first 20 callers, she's going to give a free x-rays to be able to really see what's wrong in your mouth. That's a $250 value, easily. And on top of that, and I don't know what it is she's going to give you, but she says she's going to give you a free gift because you listen to the show, and she's just like that. She is a very giving woman, and I hope that it's the toothbrush. I don't know what she's going to give because we offered a toothbrush. At least I didn't offer it on her show, but I have this wonderful toothbrush that's like magic, and it's call it my magic toothbrush, and nobody can have it. Everybody wants to take my toothbrush, but it's a special toothbrush, and so. Anyway, let's just get back to this. So now you're going to get, the first 20 callers are going to get free consultation, free exam, free x-rays. It's worth $250 plus a free gift. And this is the number to call. Get your pencils out. This is Pencil Talk Radio. This is Dr. Rosemary, our wonderful dentist. And her phone number to call is 954-489-1345. That's 954-489-1345. They're located in Fort Lauderdale on East Commercial Boulevard, very near to Holy Cross Hospital. And you will just fall in love with Rosemary. You just fall in love with Dr. Rosemary. So I just think this is wonderful. Thank you, Dr. Rosemary. I love my listeners, and you certainly have given them something very special.
You're welcome, Anita.
And so this is what we were talking about. You can't do something like this over the phone. You have to get right in their face, in their mouth,
Yes.
And see. So you will do this. And now let's just say, okay, you make a decision. And you give them a choice of you can have this, you can have this, you can have this. And then maybe it's their pocketbook that determines it, or maybe it's they worry it's going to take too long, or
Right.
they don't like pain. Or why don't you tell us? Give us an example of, in each case, we have about 5 minutes left, what it would require.
Well, it depends on each scenario. We didn't even touch on, let's say, dental implants. And the reason why
touch on implants.
Well, dental implants are also replacements for missing teeth. And that also is something that may be of consideration. That's why I said with complete dentures, sometimes it's not just a matter of putting a denture in. Somebody may not have any bone, Anita, on the bottom, and the denture will never stay in. So that person may need an implant to hold that denture in. Now, what an implant is, and the simplest way to explain it, is think of an implant as a replacement for your tooth root. Because when the tooth is extracted, it comes out the crown, which is the top part everybody sees in their mouth, and it's the root, which is underneath the gum. So the implant is actually a little titanium, let's call it a screw, which I don't like to say that, but that's what it is, and it gets drilled into your bone. Sounds painful, but it's not. You know, you're given anesthesia. That goes into your bone. That then acts as a support, and that supports the bone. That's why for me, in a half-hour radio show, to give you all the options that we could do, it would take hours, because dental implants can also support bridges. Dental implants can also support partial dentures. Dental implants can just support if you're missing one tooth. And they can support complete dentures. You know, like I said, the implant is placed into your jaw. Then for a few months, 2 to 6 months, the implant is allowed to heal. So what happens is the bone and this implant itself, what that has to happen is it has to become one. So you want them to bond together. So nothing is placed on top really to put any excessive pressure or force on it. So they can just integrate and everything can become one. Basically, you'll have a temporary tooth on top, but there really you won't be applying any hard pressure on this.
I see. Oh, that was my next question. So you will have something over it while it's growing together?
after the surgery is done, you will walk out with something, but you don't want to apply any real pressure onto the implant because you want to give that time to heal. Because if you think about it, you have a cylinder. Look at it like a little screw, a little cylinder that's placed in your bone. It has ridges in it. Those ridges is where the bone is going to grow into. So the bone and the implant are going to become one. So it's going to be rock solid. This implant is going to act as the root. And that's going to be the anchor for the crown, for the denture, for whatever it is. The implants open a whole world of options of what can be done. A whole world of options. If you're missing all of your teeth and you don't want to wear dentures, you can have 6 implants put on the top, 6 implants put on the bottom, and you can have 6 bridges put on top.
And so now you have all new teeth, and are they singly? So that would be an individual tooth, just as we have that nature.
It would be a bridge. It would be a bridge, the same way I was saying, because remember what I said about a bridge. A bridge anchors onto 2 other teeth, right? The implant is what now acts as your new tooth. That's your new anchor.
Amazing.
So there's so many options of what can be done for missing teeth that really there's no reason that when patients say to me, I don't smile, there's no reason they should never smile. And the greatest satisfaction I get as a dentist is when I see somebody how they've walked in with their teeth missing or their teeth broken down, and after we're done working on them and they leave a few weeks later, you know, depending what they're getting done, and they now are smiling. And they're so happy. I had one patient, she said, I haven't smiled since I was 15 years old.
Really?
Because she had all new crowns done in the front. Her teeth were crooked, and they were decayed. And you know what? She spent money on herself. And she said, I haven't smiled since I was 15. Do you know what satisfaction you get from that?
Wow.
That just...
Well, I have to say this, and I know that they're not listening, but my husband's daughter and her partner, he's a very nice man, but I didn't know why he didn't smile. He was very attractive, but he never smiled. Always kept his hand over his mouth. And unfortunately, they live in Colorado. But I tell you, if they come down to visit for any period of time, I am marching him over because it turns out he has no teeth, and he didn't get false teeth. He got nothing, and he has few, and he's a man in his 50s, and he's he's in terrible shape, and they don't have the money, there or whatever, but we will help them, and we will bring them. If he comes down here, I'm going to do that because I feel terrible about him. Terrible.
And we work with our patients also. That's the important thing. Patients come in, and finances in this day and age are always important for people. But, we'll always work. We have a great office manager, Mike, who is so knowledgeable in so many aspects of the office that he knows so much more than even I do. I tell when my patients ask me, what is this going to cost? I say, I explain to you the dentistry, and Mike will explain to you the rest. Because I don't even know it, but he works with patients. We really just want the patients to walk out of there smiling with teeth. That's the most important thing. So we work really, I want to say, within your budget and within your means so you can leave with something and you can leave happy. And we have done such great things for people, and that's really what gives me the satisfaction. I know when people are ready to take that next step, then they will come and they will do something. But you have to be ready. You have to be ready to do the change within yourself. And it makes a big difference. People don't realize that by not smiling, how they're affecting their entire persona, their entire well-being.
And I have to just say this about Dr. Rosemary. Even if she were not a dentist, if she was making cookies at home or whatever she did, she is a very, very kind, loving woman. And so when you think of her being a dentist and being a professional and able to make a difference in your life and your health, it just doesn't get better than that. I mean, I have to say that, and I don't want to embarrass you, Dr. Rosemary, but you have like angels floating around you. Every time you're somewhere, it's obvious that you carry this great spirit with you. So I am sure you have so many happy patients. So what I want to do is I want to take this time again, in case someone just tuned in. I hope that you didn't miss the show, but Dr. Rosemary is very dedicated to her patients and to making sure that everyone that listens to this show and everyone who's not listening, we're going to get them to listen. But the first 20 callers, because I mean the 50 people call, she just can't do that. But the first 20 people, she is offering a free consultation. That means she'll sit and talk with you just like you're hearing on the radio. She will offer a free exam where you actually get to sit in her dental chair. And then she will offer free x-rays because in order for her to really see what's going on beyond what she can see visually, it's a $250 value, and it's being offered free. And she's even going to give you a free gift. So I have to tell you, this is the best deal going, and I'm going to give you her phone number again. Now just get your pencils out. It's Pencil Talk Radio. It's 954-489-1345. I'll repeat that. That's 954-489-1345. They are located in the Adult and Geriatric Medical Center over there at 1608 East Commercial Boulevard in Fort Lauderdale. And the nice thing is that while you're there, if you need to have a podiatrist or you need to have some help with, an ophthalmologist or a dermatologist or nephrologist or psychologist, they really have a wonderful practice. And so there's a lot of things that you can do. If you just want to go there and say hello, you can do that too. So, Dr. Rosemary, I really thank you so much for taking your time. I know that you have patients waiting for you, and thank you.
Thank you, Anita.
All right. Goodbye.
Bye-bye.